Welcome back, everyone, to Takacs McGinnis Elder Care Law Hour. I'm Tim Takacs, and we're talking today about aging, disability, unexpected illness, and long life, and the problems that arise, specifically in this episode about caregiving and long-distance caregiving.
And I'm Barbara McGinnis, and sometimes you want to be a caregiver, but you really can't do it with your own hands all the time. So how do you find the right resources? What's available to do that? And who do you trust to take care of your parents? And with us is Kathy Johnson-Warner, and you're from Senior Helpers, right? Mm-hmm. And actually you've been a great friend in the community, and I know that we rely on your services a lot. So welcome today. And can you just start telling us about how to find a good caregiver and what are the options in home care?
For options in home care, you really are looking at non-medical home care. Mm-hmm. A lot of times we're confused with home health care, which is medical. Home care is when you're really looking at those activities of daily living where someone needs assistance to remain safe and independent in their home.
And so what types of services specifically do you provide, or does Senior Helpers provide? I know you're a social worker with the company. Are you actually doing the hands-on care? Are you supervising people that are doing that, or both, combination of both?
I will go in and do an assessment to determine what care is needed. So the care that we provide is from case to case. It can be anything from companion care to helping someone be more active by providing transportation, to hands-on personal care. So if you think in terms of what it takes every day to be dressed and ready for the day, or to go out, or to have your meals prepared, that's the type of care we provide, something that doesn't require a medical professional, but a skilled caregiver.
Are there any things that are there things that you can't do?
Yes, as we're licensed as a non-medical company, we can do medication reminders, but we are not legally able to fill that pill box, administer injections, things that you really need a medical person to do.
Okay, and if people need that service, where do they get that?
That's part of the reason that Senior Helpers has a social worker, because we're able to help get that home health referral or a private nursing company come in. We also partner with pharmacies that can pre-package medication. So we're able to give that guidance and still stay under licensure.
So you, and I know you hear this because we hear it all the time, is that, well, I know somebody, out there, an elderly lady that will come and watch my mom for whatever it is, and so I don't have to pay Senior Helpers.
Right.
Now, is that a good idea? I mean, we don't recommend that, but there are a lot of people out there that do that.
A lot of times people will say, I can talk to people at church who can help. And what you really need to be careful about is the liability issues. When you're having a private individual come into your home, if they get hurt on your property, if your loved one gets hurt, you have a lot that you're responsible for. When you're working with a company, you have a company that's licensed, bonded, insured, carries workman's comp, is going to take on the responsibility if their person is injured, but also if your caregiver is sick and you only have one caregiver, a private person, there's no backup. So when you're working with a company, you know that there will be a person to back up that care as well.
Right, it's part of.
So saving a few dollars an hour is maybe not such a good idea.
Can really cost you a lot.
That peace of mind's worth something, isn't it?
Right. And you want to make sure that you're having someone, every caregiver, you want that compassionate, kind person, but you need someone who's trained and has the appropriate skills.
Right.
So part of our assessment is what level of care do you need, what level of training does your caregiver need?
Well, just like I asked Gretchen, I'm going to ask you, how do you help deal with the situations when the elder refuses care, or when the spouse of the sick person says, I don't want strangers in my house. How do you approach that?
That's really common. I would say at least 90% of the cases when I go for an assessment, they're not really happy that I'm coming. So I really try to build that quick rapport and validate that feeling. No one wants to open their door every day, right? So just saying, I understand why you're feeling this way. Let's talk about some of the reasons that might be necessary. And also giving them that reminder that they're still the boss. It's especially when you have a spouse caring for another spouse and they've cared for each other for years, for someone else to come in. So just reminding them that it's like, you're still in charge. We're here to do what you tell us to do.
You know, one of the stories that we do hear from our clients or our families is, well, mom fires every caregiver that comes in. So is that a problem, or how do you deal with that?
And
it's kind of the same way that kind of what we've been talking about here.
Right, and that's another benefit to using an agency, because our goal is to get that caregiver that there's a relationship and there's a connection, and sometimes it may take a few caregivers, and we're also able to come in and back up our staff and help develop that relationship until, and again, it's just that getting the client comfortable enough to say this is beneficial and I trust this person to come in. Our goal is they'll actually look forward to that person coming.
Gotcha.
Yeah. There's a lot of non-medical companies out there. So how do you recommend for families to interview, find the right agency?
Right. One thing you want to be careful about is all non-medical companies market the same way. Not all non-medical companies hire their employees, so you want to make sure you're working with an agency, not a registry, just for the liability issues and the tax issues and payment. You also want to ask every company, do you background check and do you drug test? So you also want to look for, if you have a special diagnosis you're dealing with, does that company specialize? Do they do special training for that care? And really make sure it's a good fit for your family, as well as building in those safety measures.
So let's sort of switch gears just slightly. We've been talking about someone like maybe in Nashville or whatever it is, but suppose that you have a family that contacts you here and says, well, my mother is in Texas or some other place. Do you provide options for them?
We do. So if someone calls, a lot of times they just need to discuss, when is care appropriate, what do I need to do? And that's when we talk about if there is a geriatric case manager in their area, or what caregiving services we're aware of in that area. Because of course we can go online and find out what's available in that state or whatever they need.
So you do help integrate the non-medical and medical care. You do a little geriatric care coordination on your own. You work with geriatric. Back to, it takes a village sometimes to get it done. So it's that coordination of services in the community versus moving into an assisted living. Do you ever follow people into assisted living facilities?
We do. There will be times that a family decides that in-home care isn't the option they need to use right now, or they're looking for different options. They may want to increase socialization or activities for their loved one, or just make sure there's that 24-hour care. And we can let them know what facilities are in the community, and if they continue to need a caregiver, we will go with them. Or sometimes it's as simple as helping them make that transition, to say, let's keep this person they're comfortable with, help them move, help them get settled, and then we fade out.
Okay, so we're talking now about taking care of somebody in the house.
Right.
All right, well, at what point is that maybe not a good option for people?
The times that I really feel like are the options that you have to look at non-medical not being the best option is when the need for medical care surpasses what can be done at home. So when that person may be dealing with a chronic illness or disease that they really do need that 24-hour monitoring, or they're going to need medication adjustments and things that we are not licensed to do.
Okay.
And another difference between non-medical and medical home care is the payment source, right?
Absolutely.
So non-medical is private pay, right?
There's options.
Okay.
With senior helpers, we're actually contracted with all the Choices providers.
Okay.
A lot of times,
which is our TennCare Medicaid program.
Right, the Medicaid programs. A lot of times people won't realize that a lot of the long-term care policies have a clause that will pay for caregiving in the home.
Okay.
And we also work with the VA benefit. So part of my assessment when I go out is not just seeing what the need will be, but also if there are payer sources that are good options for them.
Great.
All right.
Good to know.
So Kathy, we're going to put your contact information up, and you can tell us how does someone get started with senior helpers?
The best start is to call our office, and we have 5 offices in the area. So whichever office you call is fine.
Okay.
And we will connect you to the office that serves you, schedule an assessment, come out, meet with you, and see how we can meet your needs.
Great.
Great.
All right, Kathy, thank you so much for being here.
Well, thank you for having me.
And we're going to talk at our next segment a little more about placement options, so stay with us.